Okay, so welcome to the YPPN. If you're catching up on YouTube, this meeting, we are very excited to have you here. We've got the wonderful Alicia and Emily from the Royal Children's Hospital here speaking alongside Victor, who's one of the young people who's worked on their co-design project, working on health literacy, creating incredible resources for young people by young people over the last couple of years. And so they're going to speak to us about the process that they've been through to recruit and support young people to be involved in this project, and share a little bit about their learnings, things that they would do differently, and what they'd like you all to think about in relation to your work as well. So I will step aside and pass over to you, Alicia, to kick us off.
Thanks so much, Sam. Thumbs up, you can hear me and see the screen. Great, thank you. I'll also acknowledge that Emily is here against her will. That sounds harsh. I had some screen tech issues, and so we're using Em's computer. She was just planning to join. I'll try not to refer to you too much, but she knows everything about this project too. So if you want, you can jump in. You're very welcome. I will. We're joining you from the Royal Children's Hospital today, which is on the Wurundjeri, the lands of the Wurundjeri people of the Kulin Nation. And we pay our respects to their elders past and present, and anyone who, any Indigenous and Torres Strait Islander people who are joining us today for this prezo. So what we will be speaking to you about, as Sam mentioned, is the health literacy project that we've both been involved with. So Emily and I have been working at the Royal Children's Hospital for about a year and a half, just over, along with two other members from our team. We all started on the same day, and we were given a pretty chunky remit to try and achieve as part of our role. Our roles are funded until November 27th this year, essentially. I know you've got a bit longer, but so the clock is ticking on what we've got to achieve. But as we'll sort of share in this presentation, we hope that we've done a pretty good job so far, from where we started and to where we've gotten to. So let's get this locating through. So the work we do as part of our project is what we call audience-led, evidence-based. So there are a lot of things that we do, and so you'll probably hear us jump around a little bit, but essentially we're creating health information for these key groups here. So parents and caregivers, young people being teens, and the age range we generally talk to in some of our projects is 12 to 17, because that's sort of the adolescent age that attends at the Royal Children's Hospital. However, when we're doing our youth engagement work, we do extend that cohort to a little bit older, because we understand that young people who are aged that sort of 17 to 25 do have recent experience that they can draw on. So gives us the ability to broaden that out a little bit too. And then, of course, the children. So we have a lot of young people, children who come through the doors here, but also whose families access the information from the Royal Children's Hospital. Let's do that. And we believe, and a big belief of our project, is that the information and the expertise at the RCH belongs to everyone in the Victorian community. So just because we're located here in Parkville and we've got all these great minds, great people working in the four walls of this building, the information that we produce does belong to every single Victorian. So how we get that to them is through a whole network of people who are interconnected with the resources we create. So that's sort of that bit that's around the outside there. So just want to share that we are always thinking of all of those parts and moving parts and resources when we work through our projects. So how the work that we do in our project fits into the whole organisation strategy is probably just is important to know from a context point of view of where we've come from and where we are working towards getting. So the RCH strategy, which you'll see on screen, is from 2024 to 26. Had some key goals around embedding young people's voice and growing the kid-centric models of care. So that was a new aspect that was added to the strategy at that point, and really ties into our project and things we discovered when we came on board. It's also, there's, a very big strategic goal around strengthening and sharing knowledge and expertise. So that is something that our project is super focused on through the production of resources that we share out into the community. And of course, our community, as we mentioned, that expertise has to get out there. So we have around 380 fact sheets on our website that are looked after by our team. In fact, really just by one team member in our team. So that's a massive job. We also now have teen-focused fact sheets as part of that suite. So that's sort of what we create. We create podcasts, we create social media content that goes on the RCH website. We connect with organizations to get that out through them and also figure out things that they need to. So there's quite a bit happening in this team of 4, as well as the youth engagement work, which is what we're here to talk about today. So just to give you a bit of context, one of our sort of guiding phrases or things that we lean on when we talk about health literacy is the sort of phrase I've got on the screen here, that an equitable healthcare system is one where everyone can easily access, understand, and use healthcare services. So the underline and in bold there is understand. So that's why we do a lot of work on creating the fact sheets, but also making sure that they are in language, tone, and style that people can understand, whether that's parents, grandparents, people from different cultural backgrounds, or young people, and all those intersecting things on top of that. So understanding is a really big one for us, but we also think about the access to a little bit in the work that we do. So that's why we've got to create these resources that makes healthcare able to be understood by the people that need to access it. So in our team, we've got a bit of a process of we listen, we share, we grow. I'll delve into what each aspect of that looks like a little bit with the time we've got, but the listen aspect relates really strongly to the National Child Health Poll, which is something our team looks after. And you might have seen emails about landing in through the YPPN mailing list, I think, every time we do a launch, which is about 4 to 5 times a year. I send that out and send out the findings. Our most recent one was around nicotine, and we've got one coming up soon about nutrition. So by doing those national child health polls, which Em is really heavily involved in, we find out gaps across the community. We survey parents and young people as part of those surveys, and we discover, okay, here are the opportunities to make change by providing information. So then we share, which is what we refer to as closing the gaps. For example, with nicotine, actually, I'll go with sun. With sun safety, we found that there were a lot of people who really didn't know all the different ways that they needed to be taking precautions against sunburn. And one for us that came through really strongly was amounts of sunscreen as well, people not using the right amount of sunscreen. So by sort of getting that information of, okay, this is what people don't know, we can produce content that helps to fill that. And then, of course, the other thing we need to do is get it out to people. A method that we've seen as being really successful for our parent channel or for parents in general is using Instagram to get short, sharp messages out to parents so that they can share those messages with their family, put on more sunscreen for the kids or wear a hat. Huge one for us has been car seat safety as well, actually, which doesn't really apply for the age cohort we're talking today, but that's one that we saw massive shifts on when we produced resources for families, and lots of people commenting that they just didn't know. They just thought they were doing the right thing with the information they had. But by seeing something on the Royal Children's Hospital social media accounts, they realised that there was an opportunity for them to do something to keep their kids safer than they had been. So this is a little bit more about that poll. We've released 40 reports from 2015, which was before we started, but since this team started working on it, it's been brought into the project we work on. But you'll see in the bottom corner there that 3,000 teens polled. So that was only in 2025. We only started polling young people last year, which probably feeds through to the fact that we only started doing youth engagement work as part of this project last year too. So it's been a really big step for us. So we're listening to young people on a nationally representative level through the survey, but we're also bringing their voices in through the engagement work we're doing, which I'll jump into. So I'm going to start just by telling a little story. about Medicare cards. So as I said, when we started this project or started working here about a year and a half ago, we knew that we needed to engage young people to build an understanding of how they see the world and how they access and digest health resources. So to do that, we had to start an advisory group, which didn't exist here in the hospitals. There was a lot of work that needed to be done around the processes. We really had to start from scratch. But we also had to start from scratch in having an understanding of what young people knew about healthcare and the systems and what topics they wanted to delve into. And I think a real wake up moment or light bulb moment for me was that Emily and I were at a school sort of in the outer eastern suburbs running a focus group. It was really early on in our project, and we were trying to gain an understanding of how far back we needed to start. And we asked the classroom, who in this classroom knows how old you have to be to get a Medicare card? And also, you can feel free to pop that in the chat if you know how old you need to be to get a Medicare card, at what age you can get one yourself, your own. So we asked that, and we everyone kind of looked unsure. And someone put their hand up, and he said, I'm seeing 16, I'm seeing 14. Neither of those are correct yet. So he put his hand up and he said, can I ask a question? Of course. And he goes, what is a Medicare card? Yes, Steph, it is 15. Sorry, by the way, seeing the chat come through. So this person in the classroom said, what is a Medicare card? And I was like, that's a fantastic question. We've come in with this assumption that you guys know what that is. Who else needs to know what a Medicare card is? And there were about 30 kids in the room, and I'd say 3/4 of them, 75%, put their hands up and indicated they didn't know what a Medicare card was. And because everyone in that room was year 10 up, pretty much all of them were over 15, so they were all eligible to get a Medicare card. So 3/4 of that room were eligible for something that they didn't even know what it was. And if that is a barrier that is stopping young people being able to access healthcare, then that is a very far back barrier that we needed to identify and create information about, bridge the gap with. So just by having that conversation, that was one really key learning of how far back we had to kind of go with our resources and the foundational information we had to put in them, which led to that being put into our fact sheet, which maybe might not have been there previously. But that moment has been like replicated thousands of times across the course of the project, where we've asked a question and we've realized that we've had to go back further in the information. We've kind of thought we could pitch it up here that, hey, you've got to be 15 to get a Medicare card. But what we needed to do was go, here's what a Medicare card is. You can get one of these when you're 15. So all of those things come together to help create what are hopefully great resources. And to talk about what that looks like from a young person perspective, I'm going to hand over to Victor.
Thank you very much, Alicia and Emily. That was great. I already introduced myself, but I'll just say a little bit more on this slide. So I'm a 19-year-old university student, and I'm from Southeast Melbourne. I was first introduced to the Youth Advocacy Committee through my high school careers counselor, actually. She just put it in the Teams. And what drew me towards it was actually being able to have a direct impact on the lives of the young people around me. And in particular, I enjoyed knowing I could spread messages on topics I was passionate about. This being things like smoking and mental health, some of which we covered last year and like we're still going to do, like with the nicotine stuff. I was never really familiar with how big the like youth advisory and youth advocacy space was, and this was my first exposure to it. So I was really excited about an opportunity to learn about public health since I'd learned some of that in high school, and I was really shocked that I could have such a big impact, even though I didn't really have any professional qualifications, which I now know is kind of like counterintuitive since we want to hear the lived experience of young people who have not necessarily been in the workforce yet or things like that. And yeah, coming into the group of such qualified young people, my goal, I guess, from the start was just to try my best, represent where I was from and deliver quality and accessible results for young people everywhere. Uh, if we go back to the other side just for a second, Alicia, I just want to give some context that the picture on the right is one of the first reels that we had made. And it was kind of in reference to a trend at the time. And it was a lot of fun. And the message overall was to, I guess, um, break down some myths about sleepwalking. Thanks. Well,
I'll just put that back. Sorry. Oh,
yeah, thanks.
there you go.
No worries. So coming into the project, for me, it was extremely nerve-wracking. Um, for most of us in that picture, we're all like high school students, and we're surrounded by so many professionals in different fields, like so many communication specialists, people who've been working with the media, people that are clinicians. All I had was the little health knowledge I had from VCE health. And unlike some of the others, and many of the others actually, I'd never worked in the space before. My hopes for coming into the project, I really wanted to learn about the nitty-gritty of public health and health promotion, and I would say I absolutely did learn how that worked. But what I didn't expect to learn was so much about communications and social media. And I would never have thought how intricate something like content creation or things like press release that Alicia and the others taught us across last year. And by the end of 2025, I would say I enjoyed the communication side of things just as much, if not more, than the public health orientated side, which I was more initially interested in.
Cool. Thanks, Victor. Also, very lovely to hear that feedback as well. So quickly speak about our model of engagement for our work across last year. So as I said, last year was the first year that we ran an advisory committee here at the RCH. And when we put the call out for members, we received quite a few applications, and we discovered that there are a lot of young people interested in the work that we were doing, whether it was because of the subject matter or they wanted to be involved in different ways. So we put together an advisory committee of 14 young people, but we didn't want to let go of, I guess, those other young people who had shown an interest. So we put together what we called the collective, or our network is the other way we refer to them as well. And amongst that, we've invited them to be part of other work that we've done across the year. So that's holding smaller groups and focus sessions about particular topics. For example, we were approached by our quality team to support some screening around pregnancy screening. Yes, and I think this was probably a little bit borrowed from a chat we had with Dan quite early on in the project. So very inspired from sharing information across the board. And the collective have also been the people who've fed into creating our content for the channel, which we'll talk about shortly as well, that we ended up creating based on the group. Moving into 2026, though, we have kind of broadened that out a little bit. So we've still got an advisory committee and the collective, and we run content creation sessions once a month. But we now also have small working groups that are planned across the year. So we've already run a nicotine working group, which was about a 6-week project, quite condensed meetings with a smaller group of 6 young people who really wanted their voice heard on the topic of nicotine or wanted to learn more about nicotine and its impacts. And then we've just kicked off our nutrition working group. And once again, nutrition, such a huge topic. So we're working with them to narrow it down to things they're seeing. One thing coming through really strongly is excessive protein advertising and advertising of nutrients that maybe aren't so necessary across social media. And then later in the year, we're planning a period pain working group, which actually will be a slight adjustment to this project because it's a massive topic, and that project working group is going to get to do some really exciting things. So that's what we've got planned. And here's what we've achieved so far. So we created a new channel on Instagram at the moment called Infectious Info. We're hoping to grow that channel across other social media platforms soon, starting with YouTube and then seeing what else is available to us. but it's allowed us to experiment and play a bit, also see what the interest is from young people in creating content and from our clinicians across the hospital. We've had almost 500,000 total views of the content on that channel, because I know that figure was taken from last week and we've already got more since then. So, you know, we are seeing some nice engagement, and we're also seeing the content sort of slowly, incrementally improve and get a little bit more targeted with the messaging, and also sort of hit people in sort of those trending ways. And we've created 16 new teen health info fact sheets, which live on the RCH website. That clunky old beast of a thing, but it's the best thing we've got. But they've had over 26,000 views since we've launched, and growing. And the more fact sheets we grow, the more people learn about them, the more link backs they get, the more useful they can be for people in the community. So for each of those teen fact sheets, we've also produced a paired parent fact sheet. So if we've got something about nicotine for a young person, we've also got a way of teaching their parents about that topic too. And we've also gained a lot of feedback and insight from the young people. Obviously, you've heard from Victor today, and I'll also hand to Victor again shortly. But we've enabled young people to provide feedback through surveys, through reporting back and creating artwork that represents their experience. And through that, we've learned that not only have they felt included, but they've also developed skills that they can, you know, take into other areas of their life. Also, I think the bonus is a few of them have learned some useful health information, which is always a great byproduct of being part of the project. And I'll hand to Victor now to finish up this bit.
Thanks, Alicia, again. So I would just like to say I have very big hopes for the second year of this project, but I think I also want to recognize the importance and necessity of some reflections. As the first year kind of went on and physical meetings became more infrequent, since we had like the big get together at the start of the year and then more Zoom and like hybrid based meetings, it was clear that the group enthusiasm was kind of dwindling down. So for this year, I hope for more interactive tasks. I know a lot of young people had fun consulting on the different info sheets and having fun in the focus groups, as opposed to the meetings. And already thanks to Alicia, Emily, Anthea, and all the other amazing people involved in the team, I can see that this is happening. Like our meetings have halved in time already. So I think that would be great for engagement. And more broadly, I hope in year two we can grow the channel even more to reach more young people, have more young people participate, and reinforce those good, healthy behaviors. Every time a post went up with me in the past, I would have so many people, all my family and friends, sending it back to me. And as embarrassing as that was, I hope it can happen for all the people creating the content, because that is kind of how the message does get spread. And even though it's lighthearted and fun, there are vital messages at the heart of all the content. More generally now, for YAGs in a broad context, I would still hope to see more young people and want to be engaged and want to be part of the decision-making process. I kind of see the RCH as like my gateway into the youth advocacy scene. And I can see that there are a lot of orgs that want to have this engagement with young people on a deep level. And as we can see, there's so many wonderful people from so many wonderful organizations today. But I think me and some other young people that I met, especially Adriel, I'm sure half of you guys have worked with him before, want to see that true partnership between people who make the change and the young people that it ultimately affects.
Thank you so much, Victor. Sam, we've got a video. Is there time to share it, or are we at time?
Yeah, I'm going to open it up for questions.
Okay.
But maybe we could show the video and people could ask questions in the chat, and then that kind of, maybe speeds that up a little bit anyway. So yeah, folks, as Alicia is about to share the video, perhaps you could have a think about any questions that you might have for Victor or for Alicia and Emily. And then we'll, wrap it up with a quick Q&A after the video is played as well.
I was a victim of Googling your symptoms online and coming up with like the most damning diagnosis ever.
I'm in year 10 right now at Uni High, just across the road.
I'm 16 years old. I'm currently in year 11.
I'm turning 18 next month.
In my first year of uni, yeah.
I'm 18 years old. I'm currently in year 12.
I'm 22 years old and am from the Maston Ranges out in regional Victoria.
I'm 13 and I'm in year 8 at the moment.
Thank you so much for putting yourselves out there, for reaching out and being part of this, and also a big well done for actually being selected into the community.
I think it was like an interesting topic, like health literacy for young people. It's not something that's talked about a lot.
A lot of the time we'll be scrolling on TikTok and there's so much information out there.
I'm aware that there are official channels where to find information, but I think on a more everyday basis, it's harder to come by.
Would you be interested in joining like a health committee? And I was like, oh my God.
I think probably the creating part will be the most fun, like making videos or making a website or just working together as a team to create something positive will probably be my most favourite part.
Alicia, I don't know if you can hear me. The sound seems to have kind of gone.
Sorry, was the sound not coming through?
Oh, that's all right. No, it was fine, and then it suddenly sort of dropped out. So,
okay.
Is that
there
something
again?
you can link to? Are people able to watch?
Yeah, I can send a link afterwards as well. It's essentially just
awesome.
Yeah, I can. Yeah, I'll share the.
Maybe it was just me. Sorry, other people are saying the sound was fine, so I'm not sure what was going on there. But I mean, it's awesome. I loved.
Get the gist.
All of the vibes were great. And I'm sure people will want to catch up on it as well. I had two quick questions that I wanted to ask. And others might have other questions as well. My first question was for you, Victor. You mentioned about being nervous when you started, which I thought is just such an important thing for us as workers to remember, that young people can feel really nervous stepping into this kind of environment. And I wondered if you can remember any of the things that the team did to help you feel confident to attend, either in the meetings when you first joined, or even just before, like the communication that they gave you as you were joining the group. Is there anything that stands out to you in that process that you think really worked, or you would encourage them to do again, or for us to think about in our work with young people as well?
Yeah, Sam, that's a great question. I'm trying to think. I think coming into it is like not coming from the background before, there might not be a whole lot you can do to make fresh young people coming into the scene comfortable. I think it really helped once I was actually in the room with all the people. I mean, Alicia and I can't remember if Emily was there on the day, but I remember Anthea was there, and they just made the space so comfortable. It was really casual. I mean, there were like snacks and everything. So I think just creating that positive space, kind of making it clear to young people that this is, although it's professional, it's not super serious, will make them comfortable. And I think giving time for the young people to meet one another really kind of breaks the ice. It is quite difficult, I would acknowledge, like coming into the space. I think my main source of anxiety was feeling like under-prepared, like, oh, these guys know so much about this sector and I've never done this sort of thing before. So maybe a reinforcement that it's okay if you're new to the space could help as well.
Yeah, love that. Alicia, is there anything that you remember you or Emily doing in the lead up to help with that process as well?
Yeah, I mean, we were really nervous too because we hadn't done anything like this before, and at the RCH as well, you know, with so many organizational complexities. I think we tried really hard to send as much information, but not too much, but thorough but useful information to the participants, you know, make them know what was going to be available to them on the day, where to meet us, all the, you know, standard stuff. In terms of room setup, we specifically made it, you know, it was round area that everyone could sort of see each other. We made sure that everyone had their own notebook that we brought for them and pens, although the pens are rubbish and they don't work. But they're little things that we were like, we just want people to know that they're welcome here and that it's for them. And, you know, lots of tips from other people about quiet spaces, fidget toys. And I'm glad to hear that the snacks are here because we always get great feedback on the snacks.
Yeah, snacks are important. It's an easy one to kind of oversimplify, but when you get it wrong, it can make a good meeting go pretty bad. And people remember good snacks. So much of community and creating communities based around food. Love free food, says Tegan. Tegan also put in the chat, if someone wanted to join in on the project, where would they find it and what options are available? Are they online? Is it all in person? Is it listed on the hospital website?
So do go on the RCH website, but it's a beast of a thing and it's a mess. And one day we're going to get a new one, fingers crossed. But we unfortunately don't have a lot of info on there at the moment, but that's probably a good flag for us to maybe pop something in the teen health info section. You can go to the teen health info section of our website and actually see the outputs that have been done. And I'll pop some links in there when I get a chance. But if you also follow Infectious Info on Instagram, there is a link in there about joining our advisory committee in our network. And once young people join that list, they will get sent regular emails. So we send an email about once to twice a month about the opportunities. At the moment, a lot of our opportunities are in person or have a hybrid model. So our advisory group is hybrid. Our content creation sessions are in person, but we're trying to work with our young people to come up with ideas and ways we can engage people to create content remotely. And a lot of our small working groups have a hybrid model, we try and, just based on the feedback we've received, we're trying to get young people to come along to at least a couple in-person sessions, because most people that let us know that that's what they want to participate in. I did also see a couple of questions from Beth. Do you want me to jump in and respond to those as well, Sam?
Oh, yeah, thanks. I missed them.
No, all good. So I can pop some links in here as well for info on joining that. But I think that's also a good flag of maybe we need to promote more for young people being able to join it and what that looks like. We have quite a few opportunities jumping up out of this. So the best way is if young people join the collective, which means they'll get put on the mailing list, they get sent all the opportunities that might intersect, especially as the project grows. But in terms of growth, Beth has asked what total staff resourcing was required to support the YAG and collective, which is required is a different question to what we actually had and were able to do. So Emily and I both do this work sort of part-time within roles where we do lots of other things. So my role is content and engagement manager for the health literacy project, which covers basically all the things we talked about with the poll, with those fact sheets, all the other resources we produce for parents as well, and the engagement work with parents. And then this work, Emily is our project coordinator and kind of does a similar vibe.
It's a lot, yeah.
She's spread across all those things too. Ideally, this work would be supported by a couple of full-time people, or at least one person full-time, and then someone on it part-time would be how I like to see it moving forward, because we see a lot of opportunities to engage with specific different sort of cohorts. So for example, we're talking about wanting to do some work with young people based regionally, specific cultural groups based on some of the topics that we're seeing come up, as well as LGBTQIA plus young people. Like, there's just so many things that for particular cohorts would be more important and worthwhile for us delving on. But right now we're pretty thinly spread, but hoping that that could grow. So I'd say you'd need at least 1.5 people But and then how do you keep the collective engaged between opportunities? That's probably don't have the solve either. We, like I said, we email them once a month or so. We have a lot of repeat customers from that collective. So last year we had of those 100 or so people that we had in our list, actually had about 60 across that group come in person across the year. That was pretty cool. It shows that about 60% of that list are quite engaged or wanting to be involved. We see that a lot of the kids come to sessions or involve in opportunities more than once. But we have also noticed that there is drop off because people might come once and it doesn't suit them. And we are noticing that signups for our content creation session are going down a little bit. So we're looking to grow. And we've also reached out to them for feedback about frequency of communication and whatnot. But I think it's also about keeping the opportunities varied across. So we've noticed that we might have someone on our list that we never hear from, but then all of a sudden, if we send out an opportunity about a topic, they will reach out, or we'll get a whole heap of names that we knew were on the list, but we hadn't heard from for other projects. Because that's the benefit of working in health, is there's so many things within it that might speak to individuals.
Awesome. Thank you, Alicia. Yeah, there's another comment around channels, but that interestingly is one of the things that we're talking about in the breakout group. So Jane's just put in there, do you know, are you using YouTube and Instagram? Or Victor's replied kind of saying, well, actually, we haven't really used YouTube. TikTok is the main channel that young people use, but that isn't necessarily what RCH have used either. Is that due to restrictions, or did you make a choice not to use TikTok? Yeah.
So we really want to use TikTok, and we're actually still working through getting the opportunity to do that. But we were told kind of early on in our project that there were some restrictions around organisations that fell under that Department of Health banner being able to use TikTok. But we're hoping we can kind of, you know, there's some hope on the horizon for us, which is good. And then YouTube is one we're super keen to explore too. It's just, the thin spreadedness of the project, unfortunately, has held us back at this point. But we're keen. We're working with our advisory committee on getting their thoughts on how a YouTube channel could look for us. And then we're going to start diving into posting on that in a couple of months.
Yeah, awesome. And Jane works in local council, so saying, we can't use TikTok either. Understand Instagram is obviously now reduced to over 16 and over. They're looking at kind of YouTube as that option. I think that's probably a very common topic and situation for people. So that will be one for us to keep an eye on and to maybe talk to as we keep going. Brad has also put, is email your primary form of communication with young people? And so, I've just clarified, is that with the YAG and the collective? And he said, but also, and the wider collective. So is that, have you got any other channels? Have you set up WhatsApp or anything like that?
Yeah, we've used WhatsApp when we're working with our committees, and we've just used it more as a reminder technique, or as a people just, you know, being able to reach out to us at the last minute. But we've found that email has been the one that actually a lot of our young people have said that they engage with. And most of our emails, when we send them out, we get about a 70 to 80% open rate, which is big. And then, you know, obviously click through based on what people are interested in. But considering we're getting a great open rate, we're going to stick with email.
Yeah, great. Cool. And some people have said about text messages being more effective than email as well. So I guess it's going to vary and depending on what works for you and your environment. Folks, I'm conscious of time. What I might do is wrap up this awesome presentation and discussion here. I'm going to turn off the recording now.